We begin with a growing health concern. Today, state health officials announced 2 more mumps cases in Indiana just this week, bringing the total so far to 36. This comes as measles reaches a 25-year high in the United States with 700 cases nationwide. Tonight, state health officials are working to stop the spread of these infectious diseases in your community. They're urging MMR vaccinations for children as well as adults who have not had at least 2 doses.
New at 6, Call 6 Investigates Kara Kenny has been digging into vaccination rates across Indiana and found how well children are vaccinated depends a lot on where you live.
The CDC recommends children between 19 and 35 months receive a series of vaccinations, including at least 1 dose of MMR. The average immunization rate for counties in Indiana is 70%, but we found some parts of our state well below that. As the country battles outbreaks of infectious diseases, Call 6 Investigates found whether a child gets vaccinated may depend on where in Indiana they live. Allison McGuy is a mom to 2 boys. She worries about diseases. That's why she's getting 1-year-old Evan the MMR, or measles, mumps, rubella vaccine.
We just want to take that preventative measure that's very safe and harmless, that could protect them from something that is very harmful.
A few tears, but well worth it, says Mom.
I guess I hope to have them avoid getting sick and then just keeping the community safe.
Allison lives in Monroe County, a community with one of the highest vaccination rates in the state at 83%, well above the state average of 70%. Allison takes her children to IU Health Riley Physicians in Bloomington, one of the largest providers of vaccines in the county.
Sounds like somebody may have just gotten a shot.
Music to our ears.
Oh, yeah. Dr. Scott Moore isn't surprised Monroe County ranks among the highest immunization rates in Indiana.
We're very proud of that fact. We put a lot of energy and resources into making sure that kids get vaccinated. Every time they come into the office, whether it's for a checkup or an ill visit or for stitches or anything, we check their vaccination record and make sure that they're up to date.
Monroe County says partnerships are key. IU Health partners with the Monroe County Public Health Clinic. Both are enrolled in a federally funded program.
That means any kiddo who has Medicaid or is uninsured or whose insurance doesn't cover immunizations can come in and get immunizations for free.
They also partner with the Monroe County Community School Corporation to hold vaccination clinics throughout the year in their elementary schools.
We think that that's extremely important, and we think that's one of the reasons that our rate is so high. I think it stresses the importance of vaccinations, and it helps parents to understand that vaccinations are safe and effective in preventing diseases.
Records show some Indiana counties have vaccination rates as low as 49%. In central Indiana, Grant County has the lowest rate at 59%. The Grant County Health Department declined our request for an interview, but told us the hurdle we come up against is lack of education provided to the parents on the importance of getting their child immunized. Monroe County may become a model for other communities. They have no plans of letting up on their efforts to keep its community vaccinated. Part of that effort is working with parents like Allison to educate them about immunizations.
To me, the protection against these diseases that they've almost completely gotten rid of in the past 100 years is a lot more important.
As of now, the state does not track vaccination rates by school, but the state is working on a report that will detail that information.
And Kara, when a parent chooses not to vaccinate, it's usually because of religious reasons, right?
Religious and medical are the 2 exemptions in Indiana. And tonight on the news at 11, we're digging into why some parents in Indiana are choosing not to vaccinate, including looking at some doubts surrounding the MMR vaccine. So don't miss our special report tonight on the news at 11. It's a very important issue and very timely right now.
All right. Thank you, Kara.